This is our science video on the respiratory and the digestive system. I'm going to be explaining some tips on how to remember functions of some organs and go a little more in depth on how you inhale and exhale. The diagrams you'll see in this video will be based on the human body because I didn't want to show any pictures of fetal pigs because some people might be grossed out. And beforehand I'll apologize for the sound quality and the video quality if it's worse than expected. Okay, I've heard some people confuse posterior with anterior, so I'll just go over that really quickly. Posterior, you can remember words like post-war or post-traumatic stress, and post-war refers to the events that occur after a war. So if you can remember after, then you can remember that in anatomy, posterior refers to the back. Anterior is just the opposite, so it refers to the front. And Mrs. Arredondo also told us, or she mentioned the dorsal fin, which is on the back of a dolphin. Hopefully you've heard of it. So another word for posterior is dorsal. So medial begins with the letter M, and middle also begins with the letter M. So if you can remember that, you can remember that medial describes any point that is closer to this mid-sagittal cut. This vertical line is the mid-sagittal cut, or the plane. Also, I want to point out that ventral is another word for anterior, because if you can remember that dorsal means the back, then ventral must mean the front. Also, if you look at this picture of a small intestine and the large intestine, you'll see that the large intestine is actually thicker than the small intestine, and the small intestine is longer. And I guess there's a lot of confusion about the length of these intestines. The small intestine is actually named the small intestine because it is thinner rather than shorter. There's a couple of ways to remember this. One way is to remember that the large intestine is thicker because it has to have a thicker muscular layer so that it can push out feces. Hopefully you can remember that the large intestine is thicker. This word, rugi or rugi, or rugae, people pronounce it differently, I guess. It begins with the letter R, and wrinkle it begins with an R sound. So when I think of a wrinkle, I think of folds, and a wrinkle is kind of similar to a fold. The rugi is just a fold in the stomach that increases surface area. For the pancreas, you've probably heard of people talking about the pancreas when they're talking about diabetes. And diabetes is just a disease that involves abnormal metabolism of carbs, so it causes increased levels of glucose in the blood and in urine. Type 1 diabetes is caused by the pancreas producing too little of this hormone called insulin, and its purpose is to regulate blood sugar and absorb glucose. And these are the functions of the pancreas. So if you can remember diabetes with pancreas, then you might be able to remember this. So for the respiratory system, I'll be talking about larynx versus pharynx. So you've probably heard of the larynx called the voice box, or the vocal cords, or vice versa. And kind of straightforward, the vocal cords produce sound, so the larynx produces sound. Or another way you can remember it is that larynx starts with the letter L, and so does the word loud. Loud refers to sound. Yeah. So you can differentiate the pharynx versus the larynx. The pharynx actually has a function in both the digestive system and the respiratory system. So for the digestive system, it's in the packet, and it says that it's the pathway for the movement of food from the mouth to the esophagus when you're swallowing. But in the respiratory system, it also allows for the movement of air from the nose and the mouth to the larynx. Now I'll be talking about how you inhale and exhale. So in my class there was a little confusion about the bottle representing the thoracic cavity and showing you how the lungs work. So to begin, the diaphragm, this is the diaphragm, it's this large muscle. It's connected to the lower section of the sternum, or the inferior border part of the sternum. Remember that inferior means lower. It's also connected to the inferior lower part of the spine, as well as the inferior border of the rib cage. So this means that the thoracic cavity up here, also here, it's completely separated from the abdominal cavity, or the stomach. So when the diaphragm contracts, it goes from this dome-shaped muscle and contracts to, a flatter shape. Now this means that the volume actually has, the volume here has increased, and because this area is smaller than this volume. So if the volume increases, and the mass of the air in this thoracic cavity, and I'm not talking about the lungs, but outside the lungs, in the thoracic cavity, if that air, the mass of that air has remained the same, then that means the air pressure decreases, because I don't want to say that air pressure and air density are the same, but they're kind of similar. So air density, when it increases, air pressure increases. When it decreases, air pressure decreases. Well, the formula for density is mass over volume. So if volume increases and mass stays the same, the density will also decrease, and the air pressure will decrease. So now you have this area of lower pressure, and the atmospheric air outside here, it's greater than the air pressure inside the thoracic cavity. So the air outside, it needs to look for a way to flow into this area of lower pressure, because air flows from areas of high concentration to low concentration. So that opening is your nose or your mouth. So the air flows down your trachea and it flows into your lungs. So let me actually write that down really quickly. This over here, this is when you're inhaling. Also, when you inhale, the lungs, they expand, so they take up this extra space. However, when you exhale, the diaphragm, it relaxes, and it's a muscle, and the diaphragm is elastic, so when it relaxes, it returns back to this dome shape. That means that the diaphragm will push upward on the lungs, and when it does so, it returns back to this smaller volume. Also, the volume in the thoracic cavity has decreased because the diaphragm relaxed. That means air pressure in the thoracic cavity increases. So there's air in the thoracic cavity pushing on the lungs, and altogether these two forces, it makes the lungs shrink. And when it does, the volume in the lungs decreases, then air pressure and air density, it increases. So now it's actually higher, the air pressure is actually higher in the lungs than outside. It's higher than atmospheric pressure. So air flows from areas of high pressure to low pressure. So it will move up your trachea, and then air will flow out of your nose. And there's also another force involved with exhaling, and it involves elastin and the alveoli, but I won't talk about that. I'll just say that the lungs are just elastic, and when you exhale, these lungs, they shrink back into the shape because it's elastic. Well, I hope this video was helpful, and thank you for watching.